This is my camera. You know when you're ready.
This is mine.
2, 1.
Good evening, it's Dr. Triggs here. Welcome to Triggs Table Talks. Everything lifestyle, Miami, healthcare, just anything I think is dope. So today I'm joined by a very special guest. Like I said, all my guests are very special. I have Dr. Stephen Wigley IV, owner of Wigley Feet Medical Nail Spa, international foot surgeon. Dr. Wigley, thank you for being here today, sir.
Hey, sorry. Thanks for the invite, man.
Hey, man.
For a long time now.
Oh, man. Well, I appreciate you being here. I know you're busy. I know you just got caught in some Miami traffic.
All day.
Hey, man. Well, we have a mutual friend, and she thought that you would be a great guest to be on here, and I couldn't agree more. So I really appreciate you being here. So my first question is, like, just jumping right into it, like, you know what I'm saying? Tell us, like, you know, where you're from, you know, your upbringing, and, you know, we'll dive more into, like, you know, what brought you in to podiatry and some of your interests that you have now.
Definitely. I'm originally from Memphis, Tennessee.
Yeah,
born and
M-Town,
raised.
yeah.
M-Town, man. Big Dolph fan.
Yeah.
Actually, first-generation college student.
Okay.
So I left Memphis at 18.
Right.
Moved to New Orleans. Went to undergrad there, Dillard University.
Dillard, yeah.
Was up there all the way up until Katrina, and just right after that.
Did you go back after Katrina?
I did, man. So Katrina would be 20 years now.
Okay.
This is 2025, so we're kind of on the 20th year anniversary. Actually, when Katrina hit, we all left, scattered around the country. I'm sure that you probably took in.
Yeah, I had a cousin that was at Xavier, and I was a freshman at UAB, and so she came to Birmingham, and I drove her back up home to Huntsville. But yeah, I remember that in
I
05.
left and went back to Memphis for a semester.
Okay.
But because the seniors especially really wanted to graduate from Dillard, they allowed us to come back.
Oh, okay. That's dope.
So we actually stayed in the Hilton Hotel, man, right down there in the French Quarter.
Right.
So our dwelling and our school was actually in the hotel.
Wow.
So we would literally go to sleep and then come downstairs, go to the third floor, and they would have cubicles set up everywhere. So
I wonder if did that help you think, like, from an academic standpoint? Because it's like one-stop shop. You like literally focusing in school, like where you're living at.
Yeah, man. I mean, it was different.
Yeah,
it was truly different. Because remember,
especially as a senior, because you started off like the traditional college campus, right?
Different college campus. I think my senior year, I had just went back out for the basketball team. Not even sure if I was going to make it or not. I had just taken an MCAT that Saturday, and Katrina hits that Monday, where it's like, hey, man, this is life changing. So, being in the hotel, man, you got to remember, it just wasn't the students of this place. It was our professors, too.
Oh, okay.
So everybody in the city was living together, man. I mean, you're talking about from the president all the way down to the freshman students. So it was wild, man.
Crazy.
It was wild, man.
And so what made you choose Dillard in the first place, coming from Memphis?
So I was actually a high school basketball player. I thought I was going to be recruited Division I, maybe low Division II. Took a few visits, and then my last stop was actually Dillard. Okay. I had actually committed to be a walk-on at Florida State University.
Okay, yeah,
basketball. Big time. And I was like, man, I'm going to Florida State, of course. And then when I ran to Dillard, man, just those white buildings got me, man, and that grass. It was beautiful.
Right.
And it's kind of felt at home, right? I was going to be going to school where it was going to be, 300-400 people in a class to really like 30 or 40 people in a class, or even less than that.
Right.
So I knew I was going to get a good nurturing environment.
Did your parents, were they HBCU grads or anything?
No, man, like I said,
you say you first generation
college students. So mom and dad had me at 16.
Yeah.
Shout out, they're still together to this day, man. So it's definitely an anomaly, man. So especially growing up in the inner city.
Right.
So, left Dillard. That July, we graduated, and I actually went back home and sold cars for a year.
Okay.
Because when I applied to med school, all my transcripts are underwater. So imagine I'm going to try to apply, and they're like, "Yeah, we're gonna waitlist you because we need the final transcripts."
Right.
So I'm like, man, I don't
even knowing the Katrina story.
Even on the Katrina story, man, they still wanted to have their paperwork buttoned up. So it was like, we're gonna provisionally accept you, but it'll be a year or so. So I was like, you know what, cool. I ran home, actually worked at a car lot, and then headed back to Miami for a post-bac program.
Right.
So I'm thinking Miller School of Medicine.
Right.
I'm going to be like Dr. Triggs here, man, plastic surgeon, you know what I'm saying? And then as I'm going through, I think I was in anatomy and physiology, and the professor just stopped me. A lady named Dr. Saeed, shout out to her, man. She was like, check out this program over at Dillard University, not Dillard, over at Barry University.
Barry, yep.
So I go out there, man. I actually check out the campus. I interview on the spot. And the dean, man, actually accepts me into podiatry school there.
And so you was just like...
I was like, man, I'm ready, man.
Yeah.
So I go back, make some money selling cars, and I moved to Miami August 2007, and I've been here ever since.
That's crazy.
So
how, like, you know, you hear the stories about Memphis being a little rough. You watch a lot of First 48, y'all are mentioned up there with Birmingham, you know?
That's right.
So how would you say, like, growing up in Memphis, like, you know, influenced you or, you know, was, you know, within your development?
Memphis is tough, man.
Yeah.
Memphis is tough. Like, I grew up in the oldest Black community in the United States of America, Orange Mound. But my parents put me around a lot of positive things.
Okay.
They kept me out the streets. So my daddy and mom, especially my father, grew up in the projects there in Memphis. So it's easy to get in trouble. So he kept me active, right?
Okay.
And I had a father, man, that didn't spare the rod. I'll be honest, man. He kept me grounded, kept me disciplined. I was always a quote unquote smart kid, but I had a little athleticism as well. So being around the AAU kids and just kept me out there on the wrong side. I would say 9 years old, like that Dolph story, saw somebody get shot.
Yeah.
I did too, man. It changed my life. Actually, at that point, that's when I wanted to be a doctor. It changed my life. I was like, I want to be like the guy who fixed you. Because literally that kid I saw get shot showed back up to my house to play basketball like 3 weeks later.
Oh, wow.
And I just couldn't believe it. I was like, man, I want to be whoever
After 3
did.
weeks?
About 3 weeks, man. All the bullet wounds came out uninterrupted.
So what happened? What was going on?
I was walking my dog, and I saw this kid just run across me. And like two guys chased after him. All I heard was pow, pow, couple
How
shots.
old do you think he was at the time?
They say this guy, he must have been like 14 years old. Yeah, about 14 years old. I pick up my dog, run home.
Yeah.
3-4 weeks later, man, the kid's outside playing on my basketball goal, man. I said, man, I want to be like the dude who fixed you. He shows me every entry and exit wound. And I'm sitting there like, damn, man, like whoever fixed you was a good job, but man, this is my ticket out. And then anybody who knows me, man, I want to be a doctor ever since then.
Did you tell that story like in your personal statement or just in your interviews or whatnot?
I didn't. I was reluctant to tell that.
Okay.
To tell that story. Matter of fact, it was some just that I knew inside it was going to keep me going, but didn't necessarily everybody needed to know.
Right.
But it was a part of my history, though.
Gotcha.
Yeah.
So, and you think that was that like inception point that really pushed you into medicine?
That did it right there. I really wasn't good at nothing else. I was like, it was for me, medicine a bus.
Yeah.
Yeah. So it was just like, man, see, I knew basketball wasn't going to be in the NBA.
Right.
But I mean, being a doctor wasn't a bad thing to fall back on. So.
Gotcha.
So my whole time in college, man, I was focused on that.
Yeah. So how was the Dillard experience pre-Katrina then?
Oof, the yard, like any other HBCU, man.
Yeah.
You know, I'm a frat boy. I'm an alpha. I pledged on the yard, man. There you go. What's up, frat? So, you know, man.
Yeah.
And then we ran the yard. I'll be honest, you know. It was like going to Xavier or Hampton or Howard.
Right.
Like the yard was the yard. You had to look fresh when you came on point. So, and you know, everybody's smart. It was beautiful seeing a whole bunch of beautiful Black people getting their stuff together, right? Because you look what people came before you, what they're doing. You can only want to be like them. Right. So, a lot of our HBCUs lose the magic due to funding, but I just want to be a part of the solution, not the problem. You know, I think that's where a lot of our HBCUs are going to it right now.
It's funny because, you almost took that walk-on position in Florida State. That would have been a totally
different experience.
Yeah, culture shock. Because high school-wise, did you go to predominantly Black school in high school?
I didn't. Honestly, I went to White Station High School right there in Tennessee.
I know White Nation.
Yeah, so we was predominantly white, but we were one of the powerhouses in America. Right. I think we were ranked number 10 in the country at that time.
Yeah, I got two of my classmates from the area. They went to White.
There you go, man. I actually think I know your classmates.
Like Newton.
Yeah, Newton. Yeah. So we know all their family there in Memphis. The Fords.
Yeah.
So there you go.
Big name out there.
Big time politicians there.
So had a good time in Dillard. Then after Katrina. Yeah. Basically living in a hotel room. So were y'all still like, did y'all even try to attempt to like pick it up in terms of like Greek life and like other like activities and stuff like that?
We actually did a lot of cleanup around the city. Okay. I mean, the city had 90% of lights were out. So when the sun went down, you should be back on campus. Because particularly, my dad was always telling me, man, when the lights go down, then that's when danger comes out, right? So for the kids at Dillard, we would try to get back to campus. But we did a lot of philanthropy, man. Okay. Dillard University took in 15 feet of water. So I know personally, I helped plant that grass there. Me and our frat brothers.
So you telling boys, stay off the grass.
Yeah, man, don't you walk in this grass, man. You know what it is, man. You knew you had a problem at the end of the night after that. So. Man. So, man, Dillard's special to me. Yeah. I go back once a year, easily. New Orleans is like second home. and then, make your way down to South Florida.
Yeah.
So if you can survive New Orleans,
Yeah.
then I figure I can survive down here in South
Absolutely.
Florida.
So how was Barry? You say you accepted a position right off the spot. How was that transition?
You know what's so weird, man? I really didn't know what podiatry was, right? So I walked in thinking, hey, man, I just want to be a doctor at this point. I didn't want my education to quote unquote go to waste. I wanted to make sure that I fulfill my dream. And I fell into a profession, man, that not too many people knew about.
Right.
I had the opportunity to be a surgeon, sports medicine. It was just limitless, but just for the lower extremity.
Yeah.
And then Barry was a small school, whereas Dillard is a Methodist school, Barry is a Catholic school, right? And the size was about the same. Okay. I mean, it's actually almost shaped like Barry, except for oak trees, there's palm trees.
Right.
So, I mean, I kind of feel at home, man.
Yeah.
And then predominantly in Hispanic society, they're pretty much close-knit, just like the African-Americans back home. So, I felt at home, man.
So when you were matriculating to Barry, did you ever deal with anything like imposter syndrome or just not feeling adequate enough? Because when you start medical school, I mean, it's a lot of knowledge coming at you real quick. They say it's like drinking out of a fire hydrant.
Man, you know what? I just didn't want to be a disappointment to nobody.
Yeah.
I think back home, a lot of people were already calling me Dr. Wigley. And I wanted to live up to that dream. So as far as an imposter, I felt like I was already there. I just had to get past these books.
Right.
And then Lil Wayne, man, kind of made it easy. He said something, man, I think he was in class U of H. He was like, take a test, man. It's in the book. It's in the book. So it's it's not that hard. So I was just like, you know what? If I just dedicate myself to this for 4 years, man, then the rest of life should just fall into place.
That's crazy.
Yeah.
So word on the street is you're trilingual?
Yeah. I
so how did
English,
that come
Spanish.
about? Yeah.
Well, English, of course, naturally. Then living down here in South Florida. And I use that trilingual as a misnomer because I did my residency training over in Hialeah, which is predominantly Cuban.
Yeah.
So I always joke, I'm like, I was the only black person to walk around, Palmetto.
Yeah.
But naturally so, you just learn the language, right? You're rounding on the floor every day. My wife is Hispanic, so of course, she teaches Spanish. My kids are the true trilingual ones.
Yeah.
And then I speak the third language, man, we both speak is medicine.
Okay.
Right? I say that, I say truly. I'm like English, Spanish,
it's its own thing.
and medicine, man.
Yeah.
It's his own language, so. And a little Creole, so.
Okay.
Probably Creole, so.
But are you Haitian?
No, I'm not.
No.
Straight up American, man.
Yeah.
Straight from Memphis.
Just being down here.
Just being down here.
Okay.
Yeah, most people think I'm Jamaican. But it's like my mentor is Jamaican, going through podiatry school, and just a lot of my patients. So naturally so, man, our people want to put you in some category.
Yeah,
right?
I know they
want to grab you right off the bat, man.
Exactly.
Now, you one of us, man. You one of us. So.
Yeah. So 14 years of experience practicing medicine.
Yeah.
What do you see the most of? The top 3, conditions, or maybe the top 3 surgeries you perform?
Man, so the number one foot deformity in the world is the bunion. It's the big protuberance on the side of your foot. Often causes some pain in shoe gear, often with walking. And then for most of us, they just don't like the look of it. So I do a minimum invasive technique where I actually utilize 2 incisions, very, very micro incisions, often invisible to the foot, to the naked eye.
And how fast does it take you to do that?
So I can do a minimum invasive bunion in about 10 to 12 minutes. So 10 to 12 minutes.
It's very impressive.
Whereas most bunions, open procedure, take about 45 to 60 minutes.
Right.
And then
longer healing and more scarring and
there
stuff.
You go, man. Yeah. So you know about all the adhesions and things like that. I don't have to cut through no layers of the foot now.
Right.
I'm getting my recovery times from traditionally 6 to 8 weeks down to get my patients back in the shoe in 3 weeks.
Oh, wow.
So, man, I'm cutting my operating room time down by 80% and my recovery time by 50%. Awesome. And I've been doing minimum invasive about 5 years now.
How's their quality of life after that in terms of activities like running or whatever they were doing?
Hey man,
baseline?
I'm in South Florida, man. We know sex sells, right?
Yeah.
Beauty is everywhere from head to toe.
That's true.
So I always say, man, when your feet hurt, everything hurts, just like a toothache, man.
Yeah.
That's 2 of the things you don't want. I tell a personal story, a patient came in my office and she's like, hey, Dr. Wigley, I want to get my feet fixed. I'm like, well, tell me what's your number one problem? And she was honest. She was like, you know what? My sex life is bad. I'm like, say why? She was like, I'm afraid to take off my socks during sex. And I'm like, man, right? I'm like, okay.
Right, okay.
So let me fix so I fix her feet 1 year later. So my next question is, how's your sex life? She's like, man, Doc, more than you ever know. So I'm like, that right there just lets you know. Just by fixing her feet, man.
Wow.
It's like the whole boomerang thing.
Yeah.
Eddie Murphy.
Oh, yeah.
There you go,
pulling the covers up, trying to look. Yeah.
Same thing, man. So I would say that was probably the number one procedure I do. And then I have a vast diabetic population.
Oh, of course.
Yeah, man. People of Hispanic and African American heritage, diabetes is rampant in our community.
Has it has it decreased any since the weight loss drugs like Ozempic or anything? Or
I haven't seen the actual data. I was just on the call about that, about the weight loss drugs, Ozempic. Has it really taken effect? It was supposed to have been for diabetics, but then now all of a sudden it's for everybody, right?
Exactly.
So
and they keep finding other things it helps out with too.
When you drop that A1C level, that level that tells you how fast your sugar level is floating around your body, then you'll have a better outcome. Usually comes with weight.
Right.
I tell a lot of my patients, you can eradicate diabetes just by dropping weight.
Yeah.
Just paying attention to your diet and all that. But it's hard, man, because our people like the rice and beans here, the plantains, things that are, full of the things that we necessarily don't need.
Right.
I just tell people, I'm not telling you to cut out your everyday life, but just do it in moderation.
Right, absolutely.
Right.
I believe the same thing. I feel like everything's in moderation. Like I eat meat, I eat pork. I just feel like everything in moderation. Is there anything like from outside of the bunionectomy, anything other foot aesthetic procedures or things that you do?
Yeah, I do a fat pad injection. Women with high heel shoes. So women that come in, that often, unfortunately and fortunately, I'm in the airport a lot, and I'm looking at people's feet, and I see, especially women in their high heel shoes, they have one or two things. They have the crowding of the metatarsals where it hurts too bad, or they have the little bruising on the back of their ankle right. there that's causing this rubbing from their slacks. So I essentially put about 1 milliliter of collagen. It's like a fat pad collagen bump that actually helps that patient walk. Usually reserved about 1 milliliter for the lesion, right? So you don't need much.
Wow.
Yeah.
That's crazy.
You just mold the fat pad. Those injections last about a good year and a half, which is very advantageous, especially to like our models down here in South Florida, right? So
I saw this thing scrolling on Instagram where some people were having their actual toes shortened.
Yeah.
That's the thing.
That is a thing now. Yeah.
Just strictly aesthetic purposes.
Strictly aesthetic purposes.
Do you provide that?
I've done before. I've done before. It's not out of the ordinary.
Right.
When I was training, I always wanted to say if anybody walked in my door, then I knew something about it or I knew how to fix it, right? This is probably why I used to be an OR junkie, man.
Right.
I mean, although I was a podiatrist, I was going to everything I could just to get my hands and get my dexterity right. I was in cardio. I was over there hanging around the gastro ward. Didn't matter. I just wanted to make sure that when I came out of residency, I was prepared for whatever came.
No, that's great, man. That's definitely great. So we talked about this a little bit, but you do a bilateral bunion removal.
Yes.
And people are still able to get around and ambulate without any problems or walk. That's, this medical term, speaking medical leads over here.
Yeah, I call it the BBR, right?
Yeah, I do the BBL.
There you go, man. So I actually coined it from you guys, man. I was like, I'm in South Florida. Like I say, I keep saying I understand the market I'm in.
Right.
Aesthetics wins all the time. We are down here in South Florida where it's 95% of the time is sunny and warm. Right. So people always have their feet out. So, cosmetic wins and people like to look good. So I was like, hey, if the BBL works, I'm sure the BBR works in my world too. Like I say, the only thing I require, they wear a special shoe. So whereas you put a faja on the patient, I do the same thing for the foot. Okay. I just use it for the lower extremity.
I ain't mad at it.
There you go, man.
That marketing is key right there.
Always.
I love that. I'm sure you've worked with like some athletes. What are some of the things that you see in some of these younger athletes or even like older athletes that they could be doing to enhance their performance or deal with some of their chronic foot problems that you've seen? Or what are some of the things you've seen with them?
Some of my buddies, man,
me.
Meat is directly proportional to some of the gouty effects later on in life. But more so, man, stretching. I think athletes don't do an adequate amount of stretching. What I mean by that, they'll stretch after. Obviously, they'll stretch before, but they won't go stretch after the activity. Right. And that right there leads to even further complications down the line, right? For me, the overpronated, the flat-footed patient,
that's
right?
Me.
Exactly. I think that's, as a podiatrist, I am too.
Yeah.
But we don't take into account that when your feet aren't aligned, that means your knees aren't aligned. And if your knees aren't aligned, you're going to have hip and back problems.
Right.
So I try to build everybody from the ground up.
Yeah.
Just employing something simple, like a simple pair of orthotics, which is inserts for your shoes.
Yeah.
To kind of balance your feet, man. Once it's balanced, and kind of takes pressure off everything.
Right.
So, I see a lot of these guys in the NBA with these medial meniscus problems and, these ACL tears is because they're overpronating. They're overly flat-footed and not addressing the issue. you.
Oh, that's a good point.
Man. I mean, look at Kyrie Irving.
Right.
I would love to take a look what just happened to him, and is he an overpronator on his feet?
Right. So personally, like I started trying to run again because I used to have like real bad runner's knee during COVID when all the gyms were closed. I was living in Ohio, so I was like, I got to do something. And like it was fine when I was running, but it wasn't like till like an hour, 2 hours later, my knees would just be aching.
Oh yeah.
And so I just stopped. And so I started it up again probably in October of last year. And I was like, oh, I'm running to the same thing. So I started like researching. I was like, oh, it looks like I have runner's knee. So I started stretching before and after. I was like, that's helping a little bit. I started taping. And then I went to like this foot store and they gave me these like strengtheners to help build my arches. And then they gave me like another kind of like orthotic, like plastic orthotic to kind of like help my arch at the same time. I think it's working. Like I'm not having as much pain or whatnot, but that's crazy. Like, cause I never would have thought of it. I was like, man, I've been athletic my whole life. It's not like I'm just trying to put a lot of wear and tear on my knees. So.
Man, you and I both, man.
Yeah.
I just remember if you're breaking towards the midline, that means you're putting more pressure here. So just externally rotating your feet, man, actually put everything in line.
Yeah, and I went to another running store and they actually looked at how I ran and they were looking like what you just said. And I had never heard that term before in terms of like, running or working out or whatever. And they were trying to make sure that I wasn't like overpronating or anything like that. And they were like, oh, you looks like you're pretty good. And then I bought these like Sauconys that are supposed to be good for flat-footed runners, but those things are so comfortable.
Yeah, man.
So, and I wear a lot of Nikes too. And the toe box is tight.
Hey, man, you're my favorite shoe right now, man.
Yeah.
One. But the problem is they're so flat.
Yeah.
So you just got to throw orthotics in there.
Exactly.
Yeah, man.
Exactly. Let's see. Oh, so, with the innovation of AI, have you been able to incorporate that into your practice yet?
Yeah, we're practicing with it right now.
Okay.
One of the bog downs of my patient population is that I see so many patients every day. I think my group sees about nearly 150, 200 people a day.
Right.
But at the end of the day, it's a lot of paperwork. So I've started slowly introducing we call large language models to where you and I can just be talking and it'll pick up the certain things in that for that patient note to try to put into a medical record. So yeah, we've been toying with it. I do some consulting internationally, so we're definitely trying to launch in those type of areas. But hey, man, I think AI is the future.
Yeah,
it definitely is.
I'm trying to implement it now. Most of it is like content creation and marketing and stuff like that. I haven't like looked in it. I'm still kind of old school, like when it comes to
me too, man. I still write on paper.
Yeah,
man.
me too.
Me too, man. I like
check boxes and all that. Because I know what I need to hear. I know what I'm listening for. So to me, it's just like quicker. But.
We cut from the same cloth, man.
Exactly.
Seem like it, man.
There we go. Well, if you like this content, remember to click like, subscribe, share. If you have any comments about this, or if you're trying to like reach out to Dr. Wiggley, of course, we're going to give his information at the end of this episode. So just stay tuned. We're only getting into it. We still got 2 parts to go. So we're going to take a little break and go from there. Welcome back. It's Dr. Triggs here. So I'm here with Dr. Stephen Wiggley, the 4th international foot surgeon, and now we're about to jump into some tricky Triggs trivia, brother. You don't win any money or anything like that. We're just tossing out a few questions to kind of like, engage the conversation or whatnot. So, before I get into that, remember to click like, subscribe. If you like this material, comment, let us know something, share if someone may be interested in podiatry and didn't even know about it. Also, remember, I am a plastic surgeon and, we got to pay some bills. So remember, your consultation is completely free. All right, so back to that. First question, it's true or false? Plastic surgeons and podiatrists can both perform reconstructive procedures on the foot.
True,
absolutely. So it's funny because my last few grand rounds, because starting as a second year in our program, you have to give a grand rounds in front of all the attendings, all the residents. And my last few, my chief year, and I think 5th and 4th year, I did lower extremity reconstruction. And my last one was foot and ankle reconstruction. Yeah. And those are some of like the hardest ones because they have like a lot of difficulty because of blood flow and things like that in terms of reconstruction and trying to find coverage and stuff like that.
Yeah, we often call in plastics, man, for some of the flaps that we do for lower extremity. Yep. So our pathways cross a lot.
Yeah, absolutely. Yeah. And when I was at the VA, the Bay Pines VA, in St. Petersburg, like we worked hand in hand with the podiatrist in our foot clinic, Dr. Gerling, who's one of my favorite attendings of all time. I'm going to have to send him this clip. He'd love it. And so we got to work with them, and so they would call us in. We got to do some of their procedures and stuff like that. So yeah, podiatry has a special place in my heart. Which plastic surgery procedure is sometimes performed on the foot to make high heels more comfortable? Foot Botox, toe shortening, fat pad injections.
All of the above, man.
All of the above. That's right. Ding, ding, ding. I know I mentioned the fat pad injection.
Yeah.
I never even heard of that before.
Yeah.
So what is this foot Botox thing? What is? I'm assuming it relaxes the muscles.
Relaxes the muscles, but unfortunately, I have a lot of people here with hyperhidrosis.
Okay.
So you're targeting just the sweaty gland. Injection in certain nerves.
Yeah.
Stops the sweating.
Gotcha.
So.
And that makes sense to make it more comfortable. And do like women like? I don't know. I feel like sometimes like the average person doesn't really think about these things unless you're going through it. But I feel like if the marketing was out there, people would like, oh, I have that going on. Maybe I should see a podiatrist. Do you feel like that the knowledge about these things in terms of like marketability is, very well known, or do you think it's still kind of like it could be better?
Oh man, we're definitely lagging behind when it comes to a marketing standpoint. As one of the more outspoken podiatrists in the field, there's so many things we do that the public don't even know about.
Exactly.
I mean, I'm a foot, ankle, and leg reconstructive surgeon. So that right there, my scope of practice is vast. So people will walk in my office to this day and be like, oh, I thought you do that too? Well, why do you have an X-ray machine in here?
Right.
And I'm like, well, I'm a surgeon too.
Yeah.
Oh, then we have to educate them.
Yeah.
And unfortunately, it's only 9 podiatry schools in the entire country. So you're talking about from an awareness standpoint, it's like nearly impossible in comparison to our MD and DO brethren. So.
No, I get it. I guess that's where like social media can really like help you like take off, I guess, at that same
Hey man,
point,
that
too.
was the best kept secret. I think as social media's come aboard, it's been raising a lot more awareness though. I'm proud of it. They consider me one of the OGs now, man.
Yeah.
I'm just like, wow. And so I see like my students and things like that. I'm like, man, y'all social media is blowing up.
Right.
So
That's
definitely.
awesome. That's awesome. What is the medical term for the surgical removal of bunions, a procedure often performed by podiatrists that sometimes combined with cosmetic foot surgery?
So just a clear bunionectomy.
Yeah.
Yeah, it's just exactly what it sounds like. Ectomy means to remove.
Yeah.
It's removing the bunion.
Yeah.
Yep.
See, there you go. Tricky Tricks trivia. See, it wasn't even that bad.
There you go, man. There
Yeah.
you go.
So, we just keeping it rolling. So now we're gonna like kind of jump into some of like your personal life, some of your hobbies and things like that. So, I know you're a family man. I know you have children. How are you able to balance this busy practice, your international work that we haven't even touched on, and and being married? Like, how are you able to balance all these three facets?
Man, shout out to my wife, man, Michelle Wigley, man. She really, really is the one who has really made Dr. Wiggley on the back end.
Right.
When I was a resident, she was a financial analyst for the hospital.
Oh, wow.
So she understands the business of medicine. And I necessarily didn't understand the business of medicine then, but I've grown to.
Right.
So we definitely have a symbiotic relationship in that regard. I think the hardest thing, man, being a sole practitioner, actually a business owner, is that work-life balance.
Yeah.
So, man, over the last, I would say 5 years, I've made myself strict cutoff.
Right.
5 o'clock, that's it.
Right.
It's kid time, right?
Yeah,
They have their activities, they're growing.
Yeah.
I got 2 boys, and then
How old are they?
I have a 5 and a 7-year-old.
Oh, yeah.
And then I got one that's due next month.
Oh,
There you
wow.
go, man. There you go. I got a little girl.
You about girl
Girl dad, here I come.
She's about to run your life, boy.
So
The
yeah,
baby
man.
girl.
Baby girl. So I've learned to work smarter and not harder.
Yeah.
I think as any other business owner, man, the hardest part is delegating.
Yeah.
Right.
Oh,
Especially
absolutely.
early on, right?
Yeah.
Early on.
This is like your baby. This is
my
your
baby,
livelihood.
man.
Yeah.
Yeah. So honestly, when I started to quote unquote start to make some money, I saw the business was growing. So I actually had my mom quit her job in the federal government, sent her back to school to get a degree. And she runs my entire billing department.
Oh, man.
So, man, I was in South Florida, only child. I didn't want to see the money, like some of our athletic brethren, man. They get paid and the money's gone.
Exactly.
And I didn't want to be that person. So I just put people around me to make me better.
Man,
So Wigley is not just Dr. Wigley. It's truly a consortium of everybody.
No, man, I totally understand that. And then like having people you can trust that have your best interest, that, you know, are really trying to build the brand or see your brand grow.
See their son succeed.
Exactly.
Right?
Exactly. Now trying to find that, like someone that's not really like a blood, you know, relative or whatever, is even harder. But there are people out there, and they truly make the difference. So how did you meet your wife?
So I was actually on a mission trip. I was a resident. True story, man. I was leaving a mission trip. I got called to the hospital because I was covering the OR, the ER, and she gets there like 7 in the morning, sees me walking down the hallway. She passes me, and I don't say nothing to her. She says good morning. Man, I literally left a foreign country. I was running to the bathroom because of traveler's diarrhea.
Yeah.
She thought I was an asshole. Yeah. Literally. She thought I was an
asshole surgeon.
Excuse my language, man. She was like, who is this guy, man?
Right.
So, you know, I passed her, and then like a year later, her homegirl runs up to me in the cafeteria and was like, yo, my homegirl think you cute. I'm like, that girl?
So girl that thinks I'm an asshole?
Yeah, man. And I see her, she books it out the cafeteria. And, you know, like any other, if you're ever in the hospital, all the finance buildings on the opposite side of campus. So I find out where she is. I just pull up on her, man. Just give her my number, man. 3 days later, she calls me.
3 days?
3 days later, man. I'm like, damn, and she made me wait. She calls me, and then like, there we go, man. The rest is history. So that day turned into, you know, we're going on, 7 years now, being married. So,
God, that's crazy.
So.
And 2 boys and now 1 girl
on the way, man.
Oh, man. You ready to go through it all over again?
You know what? Here we go. We're rearranging the house right now.
Yeah.
Everybody gets a new room.
Yeah.
Right? Oh, why did Madison, who's with my daughter's name?
Yeah.
She gets a new room. The oldest is like, yo, I need a new room. And the middle child's like, I need a new room. So it's all good, man.
All right.
That's why you work hard, right?
Yeah, no, absolutely. Yeah. It makes all the difference.
Definitely.
All the difference. So, you know, we talked about this a little bit, like looking at like sneakers and things like that. Would you consider yourself a sneakerhead?
Yeah, man. I think, yeah, I do.
Yeah.
I do.
Yeah.
I have a garage full of shoes, man.
Yeah.
And a closet too.
I got a big closet, and I've tried to slow down. And my kind of like fascination with sneakers started when I was a kid, and you know, we didn't have the means, so I would just go window shopping, and I remember being in college and in med school, like just looking at sneakers in the mall. Yeah. I was like, dang, man, one day I'm going to buy a pair. One day I'm going to buy a pair. And so when I became an attending, I was working for the hospital back when I was in Ohio before I moved down to Miami. And I ran it up.
There you go, man.
I started running it up. During COVID, I was just like, oh, boom, these are coming out. Boom, these are coming out. And now I got like this small room in my house that I've converted into a large closet, and I just got like just stacks.
So I didn't buy my first pair of Jordans, man, until after I finished residency. I was attending, bro. Then I bought my first pair of J's.
Yeah.
Yeah. So like you said, we was window shopping. Man.
Yeah.
You know, I was thinking about that the other day, man. I was like, man, I remember people used to line up down the street around the block at Foot Locker, man, for $100 pair of Jordans.
Yeah. We ain't had that. It was not happening. It wasn't happening.
No.
I remember I took my senior photos in high school from some shoes from Walmart.
Nothing wrong with that.
Yeah, man. They were clean, though.
Hey, man. Hey, man. Player get chosen garbage clothes, man. It's my brother. My adopted brother there. Shout out to Ray, man, up in Ohio, man. He used to tell me that all the time, man.
He said players.
He said player get chosen garbage clothes. That's what he used to tell me.
Players get chosen garbage clothes. I love that. So, you say your wife like handles the finances.
Yeah.
How is that dynamic? You know what I'm saying? Basically working together in terms of, because it's like you go to work, you got to work with her. When you come home, you definitely got to work with her. So how do you balance that? How do y'all make that work?
Everybody said, Wigley, this has to be the craziest idea, man, to bring your wife out of corporate America into the business. For one, I saw her talents, right? Shout out to my CPA, MBA at home. I said, man, if she's doing that for that company,
right?
Then
Match what
she'd be doing for something that's actually hers.
Exactly.
And then because I'm so busy, man, honestly, I rarely even see her.
Yeah.
Like I'll be in the office, the business is big enough where I'm like, is Michelle even in the house, or is she even in the building?
Right.
Yeah, man. So
you leaving, she's still at the crib.
Yeah, man. I'm leaving. I'm leaving. She at the crib. And then she's leaving the office to go get the kids. Yeah. And I'm still there working. So
right.
We made it work, man.
Yeah. I like how you phrase that, like imagine what she would do, with hers, what I'm saying, that show that y'all are on one page and this is something y'all are building together.
She supports me wholeheartedly.
Man,
Matter of fact, I was just in the Bahamas last week, man, and she was just like, your husband, she was like, your wife got your back.
Yeah.
Like all the time. So
man, that's a beautiful thing.
That's what's up, man.
So what is something I wanted you to kind of dive into, like, because I know you started doing some humanitarian work in residency, and that's something that you just kept on doing once you graduated?
Did. So I was at one of the few programs in podiatry that had its own humanitarian efforts. So we used to go to the Dominican Republic about 3 times a year.
Right.
We work out of the Red Cross at the military hospital there. Right. So imagine if you've ever been to Dominican Republic, everybody has those mopeds.
Yep.
People get injured, but then they don't have access to health care. So they wait for somebody like us to come over.
Right.
And then we essentially, fix them up.
Right.
And we were doing external fixation devices. That's that big halo that you see on people's legs. And oftentimes under not optimal conditions.
Yeah.
Right. So I think I found my footing and really, really wanted to help people.
You think that's really like made you a better surgeon doing seeing those complex cases?
Complex cases without access to the best materials that the United States.
You really got to be thinking.
Got to be thinking. There's been times where, I've been operating and the lights go out. And then we go grab our flashlights to keep going.
That's
man.
crazy.
So that's crazy, right? But we don't think about that in America because there's a generator somewhere that's going to keep you backed up, but it's not like that in often third world countries.
How often do you do these trips?
So my humanitarian efforts, I'm actually now linked up with Barry University. It's called Barry Without Borders. Just last week, we took 53 students and doctors over. Our medical students spent their spring break literally giving back to the Bahamian government, to a whole bunch of disadvantaged people. We saw about 1,100 people in a week. I personally did about 11 surgeries just off of that, and then for the rest of the time I spent in clinic.
Okay.
Now, I am an international consultant for the Bahamian government as well. So in addition to doing humanitarian efforts, I actually have a contract with the Bahamian government.
Okay. So what do you do for them?
So foot, ankle, and leg surgery.
Okay.
I utilize my expertise in minimal invasive surgery to service the 5.
So you're still going out there performing surgery?
I go once a month.
Okay.
So I fly to Bahamas once a month on behalf of the government. I actually go to the 5 major islands for the Bahamas, which is Abaco, Eleuthera, Freeport, Nassau, and Exuma. Those are the inhabited ones. And then hopefully in the near future, we'll be doing Turks and Caicos.
Okay.
So like I said, there's not too many podiatrists in the Caribbean country, but that patient population is just rampant with diabetes and its comorbidities.
Right.
So people like me are extremely, we're needed, very much so.
Yeah, I know they're super happy to have you.
There you go.
What are some characteristics do you have or believe for having a successful business and living, what you
Man, I have one motto, man. Treat everybody like your grandma, right? If you treat your grandmother well, for those who do, then that any patient that walks in your waiting room, you're going to treat them like that. I truly believe that.
Right.
I speak a language of love, man. Like being in South.
I can see that from your Instagram as well.
There you go, man.
Yeah.
Like, I truly believe in that. Like I don't maybe speak your tonal language, but if I can put my hand on your shoulder, it's gonna translate. They're gonna actually feel it, right? And I got away with that in Hialeah. I didn't necessarily understand or speak Spanish, but I would come up behind Abuela and put my arm on her shoulder and say, Lo siento, it's gonna be all right. It's okay. And that right there translates. And that's how I kind of built my patient population. That's how I built my practice from day one. Real story, man. My first day of residency, my grandma died.
Oh, wow.
Shocker. The lady who raised me, right? I saw a lady who didn't know how to drive, who literally had 3 jobs, raised her family. But she just held on long enough to see her grandson become a physician, man. Right. So I truly take that home with me.
Oh man, that's beautiful, man. Is there any message do you have for those that's coming up, from the rough parts of Memphis that you would like to, speak to or say, or any message for them?
Yeah, man. Keep your head down, man. Not keep your head down. Keep your head up. There is a way. Yeah. I always tell people I'm just a kid from Memphis.
Yeah. Like
I know if I did it, and I know it's saying it's a cliche.
Yeah.
But I truly, truly believe that. You don't have to do the nefarious stuff. Right. So it's okay to say no. It's okay to be the nerd.
Right.
It's okay.
Yeah.
It ain't nothing wrong with that. No. A rose out of concrete, man.
Yeah.
I think a lot of us are like that. So shout out to Maya Angelou.
Talking to a lot of young Black professionals, I think, you know, they kind of like mirror that same sentiment. And it's kind of like, you know, if they could see, I guess like the, you know, because a lot of us are very private, you know, if they could see the glitz and the glam, you know, maybe it would make a little bit more of a difference, you know. So
there you go.
You know,
every now and
sometimes
then,
you got to stun a little bit just
every
to
now
show
and then I
them.
throw them a little bit out there and say, hey man, this is possible, right?
Yeah.
You know, maybe not post it all the time, but hey man, just know that this is attainable. You know, my kids go to private school.
Yeah.
We live in a great neighborhood.
Yeah.
They're not one for nothing. It's because they know their father's going to give it everything you got every day.
Absolutely.
And then honestly, I give more so. It's about legacy now, man. I try to pour it, every little knowledge into what I give my students.
Right.
I've been adjunct faculty for 11 years now at the university, and all for free.
In conjunction with Barry?
In conjunction with Barry, man. Just in all pro bono. I don't ask for nothing.
Right.
I just ask that you teach the next man.
Yeah.
Like whatever I give you, you give to the next person. And that's how it's been, man.
Dang,
that's how I built the business, man.
Well, Stephen, man, I really appreciate you coming on,
you,
man. Hey, man, I'm glad we finally made this happen. This is our first time like linking up.
Yeah,
like, like we started from the group chat. Now we're here right now.
There we go.
But for those that's trying to like reach out, whether that's for a consultation or just to hear more about your story, or even just to contact you, just on some PR type tip, how can they get in touch with you?
I'm everywhere. Dr. Wigley Feet at wigleyfeet.com. Dr. Wigley Feet on Instagram. So
there we go.
Same thing.
Well, Dr. Wigley, I appreciate
it, man. Thanks for having me, brother. Appreciate it, man.
With that being said, this is Triggs Table Talk. Just finished up with Dr. Stephen Wigley, renowned foot and ankle surgeon, international surgeon. Like he said, you can reach out to him at Dr. Wigley Feet on Instagram, and we'll drop his information below. And with that being said, till next time, y'all, this is Triggs Table Talks, and we're out.
Appreciate it.